In this video, we will be talking about risk assessment and risk management in the criminal justice system. Risk assessment and management are key processes in managing offenders post-sentencing, especially with rehabilitation efforts. But what does risk mean in a criminal justice context? Typically, when we are talking about risk, it is usually about the risk of recidivism. This refers to the likelihood of someone reoffending once they've been released back into the community. Within Australia, it is standard practice for a risk assessment to be conducted at the beginning of someone's sentencing episode. That is, within the first few weeks of someone being admitted to prison. These risk assessments help identify what types of interventions may be most effective and identify key risk factors that can be targeted to reduce the likelihood of recidivism. However, this initial risk assessment can also help inform about the risk of violence while the offender is in custody. Essentially, how likely is the offender to be a safety risk to correctional staff, other inmates, or themselves? This also helps to inform decisions around where the offender may be housed, the level of security or handling required during their sentence, or the possibility of parole. But how can we quantify a person's risk? What are the sort of things or risk factors that we might look for? Well, research led by Andrews and Bonta introduced what they called the Central 8 risk factors as a foundation for predicting recidivism. The first 4 factors of the Central 8, often called the Big Four, are the strongest predictors of reoffending. These include a history of antisocial behavior, antisocial personality patterns, antisocial cognitions, and antisocial associates. Before we get into what each of these factors mean, it's important to clarify that in this context, the term antisocial doesn't mean shy, introverted, or withdrawn. In psychology, antisocial typically refers to behaviors or traits that go against the social norm. Things like aggression and rule breaking, for example. Now, a history of antisocial behavior refers to previous engagement with antisocial activities. This mostly refers to prior convictions a person may have, but it can also include violating conditions of parole or bail. This risk factor is pretty straightforward. The more history of antisocial behavior, the more likely a person is to engage in it again. Antisocial personality patterns are various traits such as impulsivity, sensation-seeking, disregard for others, and poor emotional regulation. Often this covers individuals who have extreme difficulties with managing anger responses or thinking through the consequences of their actions. It also refers to individuals who may be high in psychopathy, which we touched on in the first week of this course. Antisocial cognitions refers to a set of attitudes, values, or beliefs that leads someone to rationalize criminal behavior or view it as a positive. One example of this might be an individual who views themselves as a criminal and thus adopts actions consistent with that identity or label. Other examples might include having negative attitudes towards the law or justice system, or a belief that crime can be rewarding or even justified under some circumstances. Finally, antisocial associates. Essentially, this is the presence of antisocial or pro-criminal others in an individual's social circle. This might include peers who act as role models that encourage or normalize criminal behaviors. Now, the last 4 factors of the Central 8 are usually called the Moderate 4. This is because they still predict recidivism, but only moderately so. These include family or marital circumstances, school or work, leisure and recreation, and substance misuse. Family and marital circumstances can be a predictor of recidivism, depending on the quality of the interpersonal relationships. It's thought that the more involved a person is with their family or partner, they'll be less motivated or have less opportunity to engage in criminal behavior. School and work also refers to the quality of a person's interpersonal relationship within these contexts. If a person has strong attachments to fellow students or colleagues and is satisfied or feels adequately rewarded with their work or study, they're less likely to engage in criminal behavior. Recreation and leisure also refers to whether or not a person feels satisfied with non-criminal pursuits. And finally, substance misuse is often linked with criminal behavior or associated with antisocial individuals. However, past problems with substance misuse are much less reliable predictors compared to current issues with substance misuse. So these Central 8 are the key risk factors that are most closely linked to reoffending. However, these are still very broad categories. Differences in more specific risk factors can have implications for a person's overall risk and rehabilitation efforts. This brings us to an important distinction in risk assessment: static versus dynamic risk factors. Static risk factors are historical or unchangeable characteristics. Some examples of these can include a person's age, gender, juvenile and adult criminal history, or a history of substance misuse. Because static risk factors are unchanging, they cannot be directly targeted by interventions. So because we can't change the past, a history of antisocial behaviour is typically going to involve static risk factors. However, recent patterns or escalations in antisocial behaviour may indicate a more current and active risk factor, which can be responsive to change. This makes them a dynamic risk factor. Dynamic risk factors are risk factors that may change, either naturally depending on the circumstances or through intervention. Dynamic risk factors can include behavioural, affective, cognitive, or situational influences on a person's behaviour. Dynamic risk factors are important to target with interventions that reduce the level of recidivism. By addressing these factors, we can lower the chances that someone might reoffend. However, dynamic risk factors are especially important to consider when managing the risk of violence while in custody, especially for forensic patients. This is because dynamic risk factors typically immediately precede aggressive behaviours, making them suitable for practitioners to monitor and respond to. Static risk factors, on the other hand, only indicate how likely it is that aggressive behaviours may or may not occur at some point in the future. A systematic review by Greer and colleagues in 2020 found that dynamic risk factors are generally valid predictors of violent behaviour in inpatient mental health settings. By analysing 25 studies with nearly 3,000 participants, they identified 3 key insights that help us understand how these risk factors operate in practice. While most studies in the review focused on physical violence, Greer and colleagues found that 94% of the dynamic risk factors assessed were also linked to other forms of aggression, like verbal aggression, property damage, or self-directed aggression. This means that many dynamic risk factors are not specific to just one type of aggression. Instead, they may indicate a general propensity toward aggressive behaviour. The review also found a surprising degree of overlap in the risk factors identified in both forensic and non-forensic inpatient settings. This means that many dynamic risk factors can predict violent behaviour in both offenders and non-offenders who have severe mental illness or disabilities. Now, some risk factors, such as anxiety, were only reported by studies conducted in non-forensic settings. However, Greer and colleagues suggested that this is because forensic services did not measure these risk factors, as there is no theoretical explanation for why anxiety also wouldn't be a valid predictor in both contexts. Forensic services are typically more focused on rehabilitation than treatment. So while anxiety is a valid predictor for violent behaviour, it's not necessarily a direct cause for criminal behaviour. The final finding of Greer and colleagues is that the predictive accuracy of dynamic risk factors may be influenced by their temporal proximity to an aggressive incident. That is to say, dynamic risk factors may become less reliable predictors of violence over time. For example, several studies with follow-up periods of either 24 hours or 3 months found that irritability was a statistically significant predictor of physical aggression within those timeframes. However, when Van der Sande and colleagues in 2013 conducted daily assessments of forensic inpatients' irritability over a period of 12 months, irritability was not a statistically significant predictor of violence. Greer and colleagues suggest that findings such as these reflect how the influence of dynamic risk factors can diminish over time. Now, this has pretty significant implications for risk management and intervention strategies. While targeting a dynamic risk factor such as irritability may be useful at preventing violent outbursts at one point in time, continuing to target it becomes less effective as the individual may learn to control it, or there are fewer triggers for it. As such, dynamic risk factors need to be reassessed continuously over time to be able to inform effective risk management. In the next video, we'll take a look at how all of this actually plays out in practice.